Your hands feel cold, still. You rub them together, tuck them under your arms, maybe put on another pair of socks, and you tell yourself, this is just how my circulation is now that I'm older. But that explanation might be covering up something your body has been trying to tell you for months, or even years. If your hands and feet feel cold almost every day, even indoors, even under a blanket, even when everyone else in the room feels perfectly warm, that is not simply a personality trait, and it is not simply age. That pattern has a real physiological explanation, and in a meaningful number of cases, that explanation is not what most people assume. Before we go further, if you want health information explained in plain language, without panic and without sugarcoating, subscribe to Dr. Michael Carter and tap like. This channel is built for adults over 50 who want to understand what is actually happening inside their bodies. And before we continue, write your city or country in the comments. It helps us understand where this message is reaching. Now, let's talk about why this happens, because the explanation most people believe is usually incomplete. Most people assume cold hands and feet simply mean poor circulation, as if that phrase alone explains everything. But poor circulation is not a diagnosis. It is a description of an effect, not a cause. Something specific is reducing blood flow, or reducing the body's ability to generate and distribute heat. And that specific something is exactly what most people never investigate. Here is the reversal. In many older adults, cold hands and feet are not simply a normal, harmless consequence of aging skin and slower blood flow. They can be an early, visible signal of something happening deeper in the body, something involving the blood itself, the thyroid gland, the arteries, or the nerves. The skin on your hands and feet is often the first place these deeper changes become noticeable because your body deliberately reduces blood flow to your extremities first in order to protect your core organs whenever something is straining its resources. Let's start with the most overlooked cause because almost nobody connects it to cold hands: anemia. Anemia means your blood does not have enough healthy red blood cells, or enough of the protein inside them called hemoglobin to carry oxygen efficiently through your body. When your tissues are not receiving enough oxygen-rich blood, your body prioritizes your brain, heart, and lungs, and reduces blood flow to your hands and feet first. Iron deficiency anemia specifically becomes more common with age, and research indicates roughly 1 in 8 adults over 60 experience it. If cold hands are showing up alongside fatigue, pale or slightly yellowish skin, shortness of breath during simple tasks, or a noticeably fast heartbeat, that combination deserves a conversation with a doctor and a simple blood test, because anemia is treatable once it is actually identified. Here is what most people never connect. Cold hands are frequently one of the very first symptoms of anemia, appearing well before the fatigue becomes severe enough for someone to mention it to a doctor. People often explain away the tiredness as simply getting older and explain away the cold hands as simply poor circulation, without realizing both symptoms may be pointing at the exact same underlying cause. This is where the story usually gets more serious, so listen carefully and remember, this is medical education, not a diagnosis. The thyroid gland is another major, frequently overlooked piece of this puzzle. Your thyroid controls your metabolism, which is essentially how efficiently your body generates heat. When thyroid function slows down, a condition called hypothyroidism, your entire body's heat production drops. This becomes noticeably more common with age, and it disproportionately affects women. If cold hands and feet are appearing alongside unusual fatigue, unexplained weight gain, dry skin, thinning hair, or persistent constipation, this combination points toward a pattern worth discussing with your doctor. Hypothyroidism is diagnosed with a simple blood test, and in most cases, it is very manageable with the right treatment once identified. Now let's talk about the arteries themselves, because this is the mechanism most closely tied to genuine circulation in the way people usually imagine it. Thoughtful peripheral artery disease occurs when the arteries supplying blood to your arms and legs become narrowed, most commonly due to a buildup of fatty deposits along the artery walls, a process called atherosclerosis. When those arteries narrow, less blood reaches your hands and feet, especially during activity, and this can show up as persistent coldness, particularly in the feet. Peripheral artery disease shares many of the same risk factors as heart disease, smoking, diabetes, high blood pressure, and high cholesterol. Research consistently links it to increased cardiovascular risk overall, which is exactly why cold feet should never be dismissed as a purely local, minor issue. If cold feet are appearing alongside leg pain or cramping while walking that improves with rest, that pattern has a specific medical name called claudication, and it is one of the clearest signals of peripheral artery disease that a doctor can evaluate directly. Diabetes adds another layer to this picture, and it does so in two separate ways. First, elevated blood sugar over time can damage the small blood vessels supplying the nerves and skin in your feet, reducing circulation. Second, it can damage the nerves themselves, a condition called peripheral neuropathy, which can cause numbness, tingling, or a cold sensation, sometimes even when blood flow itself is not severely reduced. This combination is part of why podiatrists specifically emphasize foot checks for anyone living with diabetes, and why cold feet in someone with diabetes deserve particular attention rather than casual dismissal. There is also a distinct condition called Raynaud's phenomenon, which behaves differently from the causes we just discussed. In Raynaud's, small blood vessels in the fingers and toes overreact to cold temperatures or stress, clamping down suddenly and dramatically reducing blood flow. Curious. The affected fingers or toes often turn white, then blue, and then red as blood flow returns, sometimes with tingling, throbbing, or numbness during the episode. Raynaud's can occur on its own, especially in younger people, but when it develops later in life, it is sometimes connected to an underlying autoimmune or connective tissue condition, which is exactly why new-onset Raynaud's symptoms after 50 deserve a proper medical evaluation rather than being treated as a simple cold sensitivity. And then there are the everyday factors that quietly make all of this worse, or that can be the entire explanation on their own. Certain medications, especially beta blockers used for blood pressure or heart conditions, work partly by narrowing blood vessels, which can leave hands and feet feeling colder as a direct side effect. Smoking causes blood vessels to constrict, directly reducing circulation to the extremities, and it also accelerates the artery narrowing we discussed earlier. Thoughtful low body weight and reduced muscle mass mean less internal heat production and less natural insulation, since both fat and active muscle tissue generate warmth. And simply sitting for long periods without moving your legs and feet reduces blood flow to those areas regardless of your underlying health. This is not about panic. This is about pattern recognition. And pattern recognition is something your doctor cannot do for you unless you actually notice the pattern first. There is one more mechanism worth understanding because it explains why cold extremities become so much more common specifically with age, even in people without diabetes, thyroid disease, or artery disease. As skin ages, it naturally becomes thinner, and the layer of insulating fat directly beneath it gradually decreases. At the same time, the small blood vessels near the skin's surface become somewhat less responsive, meaning the body is slightly less efficient at directing warm blood toward the skin of the hands and feet to maintain their temperature. This is a genuine, normal part of aging, and by itself, it is dangerous. But it also means that in older adults, any additional factor, whether it is mild anemia, a slightly underactive thyroid, or early artery narrowing, has less natural buffer to work with, and its effects on hand and foot temperature become noticeable much sooner than they would in a younger person. Curious. Before we go to the next part, tap like if this explanation is making the pattern clearer for you. Encouraging. It helps this video reach more older adults who may be dismissing the exact same signal as simply getting older. Now let's talk about what you can actually observe, because this is where the video becomes practical. First, notice the pattern of symmetry. Are both hands and both feet equally cold, or is one side noticeably colder than the other? Symmetric coldness, affecting both sides equally, is far more consistent with the whole body causes we just discussed, like anemia, thyroid changes, or medication effects. Coldness affecting only one hand or one foot, especially if it appears suddenly, points toward a localized circulation problem in that specific limb, and deserves prompt medical attention rather than being written off as unusual. Second, look closely at skin color. Take a moment, in good lighting, to look at your fingers and toes. Is the skin its normal color, or does it look unusually pale, bluish, or reddish purple? Press gently on a fingertip and release. Healthy circulation should return the pink color within 2 to 3 seconds. This is sometimes called a capillary refill check, and while it is not a diagnosis, a delayed return of color alongside coldness is worth mentioning to your doctor. Third, pay attention to what comes with the coldness. Are you also unusually tired lately? Has your hair been thinning or your skin unusually dry? Have you gained weight without changing your diet? Do you feel short of breath doing things that used to feel easy? Do your feet hurt or cramp specifically while walking, then ease up when you rest? None of these signs alone confirms anything, but together they form a pattern. And that pattern is exactly what a physician needs to properly evaluate what is going on. Fourth, think about your medications. Do not stop or change any medication on your own. That decision belongs to your doctor. But it is completely reasonable to ask your doctor whether a medication you are taking, particularly a beta blocker, could be contributing to persistent cold hands or feet, and whether an adjustment might help. If you have noticed this pattern in your own life, write one word in the comments: yes. Not your private medical details, just yes. Thoughtful. It helps us understand how many people are quietly dealing with this and never talking about it. A simple daily observation habit can make a real difference here. For about a week, notice roughly what time of day your hands and feet feel coldest, whether it happens regardless of room temperature, and whether it is affecting both sides equally. Write down anything unusual you notice about color, numbness, or tingling. A week of specific observations turns a vague complaint into something a doctor can actually work with. It also helps to notice whether the pattern is stable or changing. Cold hands and feet that have been present, unchanged, for years is a very different clinical picture than a pattern that has clearly worsened over the last few months, or that has suddenly appeared for the first time in your 60s or 70s. A steady, lifelong pattern is often simply a personal circulation tendency, a pattern that is clearly new or worsening, especially alongside fatigue, weight change, or leg pain while walking, deserves a more focused conversation with your doctor, not because it is automatically dangerous, but because change itself is the signal worth investigating. Let's walk through a realistic example because abstract mechanisms are easier to understand with a real scenario attached to them. Picture a 72-year-old woman who has noticed over the past year that her hands and feet feel cold almost constantly, even in a warm house. She assumed it was simply her age. She also mentioned, almost as an afterthought, that she has felt more tired than usual and that her hair seemed to be thinning a bit more than before. Surprised, individually, none of these facts seemed connected to her. But together, they describe a pattern that points toward a possible thyroid issue, something a simple blood test could identify clearly, and something that would have gone unmentioned to her doctor if she had not learned to notice the pattern as a whole, instead of dismissing each piece on its own. This is not about turning ordinary aging into a source of fear. It is about learning to describe what your body is doing with enough precision that a doctor can actually help you. Most people describe symptoms vaguely. I'm always cold. A vague description leads to a vague response. A specific description leads to a specific answer. Now, here are the situations where this stops being something to simply observe and becomes something that needs medical attention without delay. If one hand or one foot suddenly becomes cold, pale, and painful, especially if it also looks noticeably different in color from the other side, seek emergency care immediately, because this can reflect a sudden blockage in blood flow that requires urgent treatment. Urgent. If cold skin appears alongside chest pain, sudden confusion, cold sweat, or a rapid or irregular heartbeat, do not wait, seek emergency care right away, because cold, clammy skin can be a sign the body is in shock, including during a heart attack. If you notice a sore, wound, or ulcer on your foot that is not healing, especially if the skin around it is turning dark, blue, or black, seek medical evaluation promptly, because this can indicate a serious circulation problem that can threaten the tissue. If numbness, tingling, or coldness appears alongside sudden weakness, difficulty speaking, or a drooping face, seek emergency care immediately, as this combination can indicate a stroke. Serious. These are not the everyday version of this pattern. These are red flags, and red flags always come first before any explanation of mechanism because your safety matters more than understanding the science behind it. For everyone else, the everyday version of this story, here is the honest, non-dramatic truth. Persistently cold hands and feet are common. In most cases, they are manageable and often treatable once the underlying cause is actually identified. But that identification cannot happen if the symptom is simply dismissed as an unavoidable part of getting older. Clinical experience shows this pattern repeatedly. The body rarely changes without a reason, and cold extremities are very often the body's way of showing you something that has been building quietly in the background. This does not diagnose disease by itself. This video cannot and should not replace an actual evaluation from your doctor, but it can help you walk into that appointment prepared, with specific observations instead of a vague complaint. Instead of simply saying my hands are always cold, you can now say my hands and feet are cold on both sides every day. I've also been more tired than usual, and I notice my feet start hurting after walking a few blocks. Encouraging. That single sentence gives your doctor far more useful information than most patients ever provide, and it dramatically increases the chance of an efficient, accurate evaluation. When patients report this pattern to doctors, the common evaluation often includes a simple blood test to check for anemia and thyroid function, a review of current medications, a physical exam checking pulses and skin color in the hands and feet, and sometimes a specific test comparing blood pressure in the arms and ankles, which can help detect narrowed arteries in the legs. None of this is complicated. None of this is invasive. It is simply the process of finding the actual mechanism behind the symptom, instead of assuming it is just circulation or just age. There are also simple, doctor-approved habits that can genuinely help without replacing medical care. Dressing in layers and keeping hands and feet covered in cool environments, since prevention is often more effective than trying to warm up after you are already cold. Moving your fingers, toes, and ankles regularly if you sit for long periods, since gentle movement encourages blood flow. Avoiding smoking, since it directly constricts blood vessels and worsens circulation over time. Staying physically active within whatever level is comfortable and approved by your doctor, since regular movement supports healthy circulation throughout the body. And getting a simple blood test for iron levels and thyroid function if this pattern is new, persistent, or accompanied by fatigue, rather than assuming it will simply resolve on its own. None of these habits are a guarantee. None of them are a cure, but they can meaningfully support circulation and comfort for many people, especially when the underlying cause involves everyday factors rather than a more significant medical condition. Warm water soaks for the hands and feet, kept warm rather than hot, can also provide gentle relief and encourage blood flow before bed. Avoid overdoing this, and always avoid hot water, since reduced foot sensation, which sometimes accompanies these conditions, can make it hard to notice if water is too hot until damage has occurred. Curious. Checking water temperature with a thermometer, rather than relying on how it feels, is a small but meaningful safety habit. Let's bring this back to where we started. Your hands feel cold again, and you assume it is just your circulation, just your age, just something to live with. But now you understand what is actually happening underneath that moment. Blood that your body is deliberately redirecting away from your extremities to protect your core. A thyroid that may be running slower than it should. Red blood cells that may not be carrying enough oxygen. Or arteries that have quietly narrowed over years without ever announcing themselves clearly until your hands and feet started telling the story instead. That is the real reversal here. The symptom is visible. The underlying cause is very often hidden. Small sign, large mechanism. The body changed, but the explanation most people were given never changed with it. You do not need to panic about this, but you also should not dismiss it. If this is a pattern you recognize in your own life or in the life of someone you love, next step is simple. Mention it to your doctor, specifically, clearly, and with the observations we just walked through together. If this helped you understand your body more clearly, subscribe to Dr. Michael Carter, tap like, and write your city in the comments. Your comments genuinely help shape the next videos we create, and they help us understand which patterns are affecting the most people watching this channel. This video is for educational purposes only and is not medical advice. always talk to your doctor before changing any medication, supplement, diet, or exercise routine, and before making any decisions based on what you learned here today. Take this information, bring it to your next appointment, and use it to ask better questions. That is exactly what this channel is here for, and it is exactly why understanding the mechanism behind a symptom matters just as much as noticing the symptom itself.